Hello everyone, my name is Heather Holliday. This presentation has been created to discuss a specific rural grant organization that could potentially help support my DNP project. This rural grant opportunity is funded by the Sunflower Foundation. This presentation is meant to discuss these following objectives in order to allow viewers the opportunity to identify if the grant opportunity fits their project and how this particular foundation supports my DNP project. Currently, in Kansas, there are 105 established counties. One of the 105 counties is known as Pawnee County. Pawnee County will be the focus of my geographical location due to that's where I live. Pawnee County population as of 2017 is 6,838 residents. The county of Pawnee includes cities of Garfield, Larned, Roselle, and Burdett. Within the county of Pawnee, there is only one health department and one hospital, known as Pawnee County Health Department and Pawnee Valley Community Hospital. Because these two are the main health care facilities and I am currently employed at Pawnee Valley Community Hospital, I decided my project would revolve around health promotion in the communities of Pawnee County with the collaboration efforts of Pawnee Valley Community Hospital and the Pawnee County Health Department. If you look on the slide, figures 1 through 4 are images of the 4 cities within Pawnee County. The bottom figure, number 5, shows Pawnee County in relation to other counties within the state of Kansas. My hope for my DNP project is to use data from valid sources to determine what Pawnee County needs as a community. One need in terms of healthcare is to lower heart disease. As reported by U.S. Department of Health and Human Services, heart disease is a result of high blood pressure, high cholesterol, diabetes, smoking, obesity, physical inactivity, and unhealthy diet. These factors are all modifiable. Of course, there are some factors that are not modifiable, such as age and genetics, that also contribute to heart disease. Pawnee County is ranked 69th out of 105 counties for adult obesity, averaging about 29% of the population as obese. In comparison, Kansas' average is 28%. Adults who smoke in Pawnee County are about 17% of the population, whereas Kansas sits at 18%. Physical inactivity for Pawnee County is 23%, which is the same as the entire Kansas population. Individuals in Pawnee County that monitor their diabetes is about 72%, whereas the Kansas average is 86%. The percentage of populations that have access to exercise opportunities in Pawnee County is about 58%, whereas the state average is about 76%. Additionally, 5% of Pawnee County residents do not have access to healthy foods, which is actually better than the 8% average who do not have access to healthy foods in Kansas. As you can see, many residents of Pawnee County are in need of reducing their risk of heart disease. I believe with the initiation of health fair titled Healthy Hearts in the Heartland, Pawnee County residents would have access to free education materials and testing to assess their risk factors of heart disease, education on heart disease, and how to reduce risk factors, and help developing a plan to implement these risk-reducing strategies into their daily routines. This all would be made possible if my place of employment, Pawnee Valley Community Hospital, could receive a rural grant to put on this health fair for Pawnee County. One grant opportunity for Kansas is provided by Sunflower Foundation. On this slide, there are just a few ideas that I would like to include in the Healthy Hearts in the Heartland Fair. So, here's a little bit about Sunflower Foundation. The Sunflower Foundation is a foundation that was created in 2000 due to a $75 million settlement between Blue Cross Blue Shield of Kansas, Kansas Attorney, and Kansas Insurance Commissioner. The foundation is a nonprofit organization that is classified as a public charity. Sunflower Foundation emphasizes and supports Kansas programs that serve the poor, underinsured, uninsured, that promote preventative health care and support activities aimed at promoting a healthy lifestyle. Sunflower Foundation's mission is to serve as a catalyst for improving health of all Kansans. They achieve this mission by focusing on three primary approaches. 1. Healthy living and active communities. 2. Healthcare. And 3. Advocacy and policy. Let's discuss the first objective. Does the organization fund projects in your area, state, or city? The organization funds projects in all 105 counties of the state of Kansas. The main objective of the Sunflower Foundation is to improve health of Kansans through grant opportunities. Sunflower Foundation does not fund projects outside of the state of Kansas. However, if the official office of the grantee is outside of the state of Kansas, but strictly Kansas Health will benefit, the grant might be awarded. This is up to the board members. Pawnee County has received 2 grants from Sunflower Foundation. The 2 grants Pawnee County has received are a grant awarded to Pawnee County for extending a walking trail at Camp Pawnee in the amount of $36,000. The other grant was awarded to St. Joseph Memorial Hospital, which is now Pawnee Valley Community Hospital, for ITV equipment and a server in the amount of $15,626. Here you can see that the Sunflower Foundation has made it easy to search a search map that shows grants awarded to each county. The grants can be filtered by selecting a county, an area of interest, or a year. On this slide, we will discuss the second objective. Does this organization fund projects in your subject area? The Sunflower Foundation funds projects in several different project interest areas. The 3 umbrella project areas are healthy living, healthcare, and advocacy. Project interest areas within the 3 categories are access to healthcare, advocacy policy, aging, built environment, capacity building, economic crisis response, health disparities, integrated care initiative, other, physical activity and nutrition, special initiative projects, and tobacco. My DNP project would most likely fall under the category of other or special initiative projects. Objective 3. Does the organization fund projects at the level of your project? Different levels of project funds are national, regional, state, or local. Sunflower Foundation provides grants throughout the state of Kansas. Therefore, the level of project funds provided by Sunflower Foundation could be considered state. Funding from Sunflower Foundation is not supplied to individuals. Grants are awarded to organizations. The answer to the question is yes. Sunflower Foundation provides grants statewide. My project is local. However, my county is a part of the state of Kansas. Therefore, the funding for my project is available through the Sunflower Foundation since they serve all counties in Kansas. These funds also support startup projects for organizations as long as the organization meets the criteria to qualify. Let's discuss Objective 4. Does the organization fund projects for your type of organization? Sunflower Foundation provides grants to organizations that meet certain criteria. Eligible criteria includes organizations that are classified as tax-exempt under Section 501(c)(3) of the Internal Revenue Service Code, and organizations that are recognized as an instrumentality of state or local government. Tax-exempt organizations under Section 501(c)(3) are considered not-for-profit. The Sunflower Foundation provides grants to those wishing to better public and community health in their area. Pawnee Valley Community Hospital is a HaysMed partner as of 2010. Both facilities are not-for-profit organizations. Since there have been previous grants awarded to Pawnee Valley Community Hospital from Sunflower Foundation, I know that Pawnee Valley Community Hospital is an eligible organization. Does the organization have a funding cycle within your timeline? Sunflower Foundation provides grants on a request for proposal basis. Requests for proposal announcements are made on the Sunflower Foundation website. An organization can request to be notified when the foundation opens up a request for proposals. Requests for proposals are open throughout the year. However, there are no current requests for proposals open at this time. When a new request for proposals is launched, the Foundation will host a conference call to help organizations better understand the purpose of the request for proposals and how to submit a proposal. Dates and times of conference calls are included in the documents and posted on the website. The last request for proposals was opened in April of 2017. This appears to be the only downfall of this foundation in terms of grant opportunities. The best option would be to receive announcements when the Sunflower Foundation opens its request for proposals. Here are my references for my rural grant opportunities. Thank you for listening.